Sarabhan, Kalipinam, shall we start?
Yes,
Meena ma'am, shall we proceed for the session?
Yeah, yeah.
yes.
Yes, ma'am.
Okay, ma'am. A warm good evening to one and all. I, Dr. Purnima Pandari, NSS Program Officer, along with my co-NSS Program Officer, Dr. Pallavi Rani, and Dr. Sarabjit Kaur, who is co-convener of the Medical Committee of Meher Chand Mahajan, DAV College for Women, Chandigarh, welcome you all to yet another interesting session, that is Isolation and Post-COVID Care, Know the Facts. It is being organized by NSS units and Medical Committee of the college in collaboration with Fortis Hospital, Mohali, under the able guidance of our worthy principal, Dr. Nisha Bhatt. We all are living through these uncertain times, experiencing unprecedented crisis, the global COVID-19 pandemic. What we are discussing today is something which is very, very important, as a large number of patients now are on what we call home isolation. They are being managed by the physicians through teleconsultations, through prescriptions that are being given to them in a timely manner. Some of them are relying on the information which is being shared over the internet and social networking sites. Thus, it becomes imperative to look for the signs and pieces of evidence that are behind managing COVID-19 patients who are on home isolation. What are the do's and don'ts of isolation? Who all should actually go in for home isolation? And most important thing, what are the challenges that we face as caretakers if we have individuals at our place who are on home isolation? Moreover, once the person gets cured, one needs to know what sort of complications are expected, as it is important to be aware that COVID infections can have long-term side effects. Therefore, it is very important that we, as NSS volunteers, must understand the limitations of home isolation, the challenges that we face as far as home isolation is concerned, and also empathize the ways through which post-COVID related complications could be handled efficiently. Before we get onto the session, I would like to introduce our speaker for today's webinar, Dr. Anita Sharma, who is heading the Department of Lab Medicine, Fortis Hospital, Mohali. She is an esteemed member of Indian Association of Medical Microbiologists and has extensive knowledge in the respective field of medicine. Without taking much time, I invite Dr. Anita Sharma for the session. Ma'am, welcome aboard. Before that, I request everyone to kindly mute your mics. If you have any question regarding the topic, kindly post your comment in the chat box, which will be taken at the end of the session. Over to you, Anita ma'am.
Thank you, Dr. Purnima, and good evening, everybody. Just a few things before I start. Am I audible?
Yes, ma'am. You are audible, ma'am.
Yes, ma'am.
Let me just share my presentation. Okay, is my presentation visible to everybody?
No, ma'am.
Ma'am, just click on the presentation. I think you are presenting the screen. Just uh, click on the presentation.
Just a second.
Sure, ma'am.
Is it now visible?
Yes, ma'am. It is visible now.
Okay, just a second. All right. So good evening again, and thank you, Team MCM, for this opportunity to connect with the young students over there. As you very rightly said, COVID-19 is a burning topic, and this last 1 year we've heard so much about it, and the information and the news and the research is still evolving. So what was relevant, a few months ago may not be relevant as we go forward, and I think it's a very important time to yet talk about it again, because we feel that the cases are decreasing, so maybe better days are ahead, ahead of us. While that may be true, but still we need to be cautious of the fact that the COVID is not gone anywhere, and a large percentage of a population is still vulnerable to this disease. So I think thank you very much once again for organizing this very important topic. As young students, you would realize that many of you may not have taken the vaccine as yet, and as things open up, you will be going out, meeting people, and therefore the risk is always around us, and hence we need to be very careful and mindful about the risks around us of COVID, and take appropriate measures to address that. So in the next few minutes or some half an hour or so, I'll be discussing what I've been asked to share about isolation and post-COVID care. How do we manage these patients who are inside, recuperating from this disease while staying at home? So, just a few introductory slides before I come to the topic. As we have seen that, these last 2 months of April and May were absolutely devastating for many of us in this country, where we saw an explosive rise in numbers of infections and deaths. Yes, the second peak was expected, but the way it happened within no time, as you can see in this graph, there was a absolutely steepest rise that we've ever seen anywhere in the world. Now, such a large number of cases presented with this disease, and it not only troubled the patients and the families, it also completely overwhelmed the hospitals. And every day we would see it in the print media. There's a lack of beds, the oxygen is not available, the life-saving drugs, antiviral drugs are not available. People were running from pillar to post to have these things organized, to have the oxygen cylinders shipped. There was a mad rush around the hospital, and everybody wanted to get admitted, whether they actually required admission or not, because there was so much of panic amongst people. So therefore, it was a very harrowing time for families, patients, and also the healthcare workers inside the hospitals because of these very reasons. Coupled with that, what we also saw, that there was a complete infodemic in the social media. There was so much of information overload, some very right, some just forwarded post, which also generated a lot of scare amongst people. And no surprises that, there was so much of anxiety and panic amongst even people who were just, not suffering from the disease. So what brought this on? What brought this second wave of COVID in the manner that it did? There were many reasons for it. Yes, of course, the virus, it mutated. There was a new strain which was, going around in our country, known as B.1.617. And this strain, as compared to the previous strain that we saw in the last year, outbreak, it was more virulent. It was able to transmit very rapidly from one person to another. And consequently, this time what we saw was the entire families were getting affected, as compared to the last year, where maybe 1 or 2 members would get affected with the disease. So definitely there's some viral factors which led to this explosion, but it was also a fact that it was coupled with the fact that there was a inappropriate behavior. I'm sure as you went across into the markets and all, or you would realize that people had forgotten to wear the mask, and they were like, excuse me, just a minute, please. Is there a problem? Ma'am, is my screen available to you?
Yes, ma'am. Now your face is visible, ma'am. Now this is perfect, ma'am. That's
Okay.
it. Thank you.
Okay, good. I'm sorry for this small interruption.
Okay.
Yeah. So then, as I said, the viral strain was also accompanied by COVID inappropriate behavior by us. We threw caution to the winds. We were moving about in groups. We thought that COVID had gone, and yes, it was because in the month of January and February, we did see a complete nosedive into the case, which we really couldn't explain as to why there was sudden drop in these cases. Having said that, there were certain super spread events like elections and all those melas in some part of our country that also led to an increase in the spread, coupled with complacency And yes, we opened up, and a lot of things were happening as before. So all these factors contributed to generating this very sharp second wave, which really caught us by surprise, all of us, the administrators, the government, the people, the healthcare, even though we knew that the second peak was coming. So the need of the hour currently is that, if you're COVID negative, you need to keep yourself updated, you need to follow the COVID appropriate behavior, and yes, get vaccinated. And God forbid, if somebody does turn out to be COVID positive, you need to, first of all, stay calm, follow your doctor, you need to monitor yourself very closely and manage the disease as per your status. And for that, you need a close medical supervision. So even though there are signs of easing up, even now as I speak, the number of cases are really coming down, and we have a real hope of things getting back to normal for the next few months at least. As I said, we all need to be aware and mindful of the risk and take appropriate measures to mitigate that. So just a few words about the disease per se. We all know that the COVID disease, it causes the multi organ involvement in many of us. But important to understand is that in majority of the population, say up to the tune of 80%, the disease would be asymptomatic or mild, and even only in about 20% of the cases would a hospitalization or some kind of a hospital care would be required. So what I mean to say here is that about 80% of these patients can be managed very nicely at home itself. So if you look at the disease course, it can be divided into two categories: the acute phase and the post-acute or post-COVID or long-haul phase. And in the acute phase also, the disease progresses or could progress from mild to moderate to severe. And the entire duration for this particular acute phase may last from up to a few days to up to 4 weeks. So if the patient is very mildly symptomatic, the commonest presentation that we see is fever with chills, with or without chills. There could be dry cough, a feeling of sore throat, and tiredness and fatigue is a very defining symptoms. Headache can also be there. And in this part, these months, in the second peak, what we have seen is that the congestion of nose is also a very common presentation. Needless to say, you can also have the loss of taste and smell, and you must understand that all of these symptoms may not be present in all the patients. So very often the patient just complains of I had one episode of fever because I had ice cream, because I had a cold shower. So people tend to correlate these things with these kind of symptoms which you would normally tend to ignore. But in the times of these pandemic, my suggestion, request would be not to ignore these symptoms and keep the risk of COVID high in your minds and get yourself investigated. So such patients, the mildly asymptomatic patients, can be very easily managed at home setting. In some patients, the disease may take a turn for worse, and you could go on to develop symptoms like breathlessness, increasing cough, a fever not settling down, or turning into a high-grade fever more than 101 degrees. And a very important sign is the fall in your oxygen saturation. So one thing that we've seen with COVID is this pulse oximeter has really gained a lot of importance, and people are just using it very, very frequently, sometimes unwarranted use also. So these are the two parts of the acute phase. And once your acute phase is over, that means you've recovered from COVID. Some patients may keep on having these symptoms even up to a few months, from say 3 months to 6 months also. And these symptoms could be very vague, multi-system, could be persistence of respiratory symptoms, happening of joint pains, headaches, something what we call as brain fog, anxiety, depression, and so on and so forth. So this is the entire gamut of the disease. We are still understanding a lot about this disease more. We know a lot more than what we did last year. But again, the science is evolving, and this is throwing a lot of surprises in our way, and we are still learning from it. So coming to the home management, as I said, the mild cases can be very easily managed at home. So for the management at home, the key piece here is the isolation. Now you need to understand that these patients need to be isolated so they do not spread or transmit the virus to the other patients around, right? So globally, the how they have managed the pandemic is by test, track, and treat. That means testing is the goalpost. And if you remember early on, India was flagged for this reason, that we are not doing enough testing. This is, if you increase your testing, you'll be able to pick up that many more patients, and you will be able to isolate and hence contain the pandemic better. So along with the isolation, yes, of course, we have to manage patient care, but very important aspect of it is also a caregiver, because as you understand, once the patient is isolated, his other needs also need to be taken care of. And therefore, in many of the cases, the requirement is that of a caregiver. Having said that, I would just, like to share that, in my hospital also, when many of our caregivers, they felt sick, some of them were staying in PGs and paying guest accommodations and single room and such on hostels even. They managed on their own, but of course they were supported very well by a good support system. So it's not that if you're mildly symptomatic, you can very well take care of yourself even by staying by yourself, as long as you have a good network of friends and family who can support you. So this is caregiver is important, but not absolutely essential in many of the cases. So before I go further, you need to keep in mind certain timelines with respect to isolation as to how many days do you need to be isolated. So if the case is of mild disease, or you have no symptoms, but you were just incidentally tested positive on the report for some reason, you need to isolate for 14 days. Now, the initial recommendations was for 17 days, but now it has been reduced to 14 days. And the condition is that in the last 3 or 4 days, you should have no symptoms. That means you should be absolutely fine in the last 3 or 4 days of your isolation. So very nicely, you can 14 days, you can simply, wash yourself, keep your surroundings clean, and you can just walk out after your isolation. On the other hand, if a caregiver or a close high-risk contact of a COVID positive patient is there, which means any other person who has had a high-risk contact with a COVID positive patients, which means they have been staying together, or they're members of the
Excuse me, ma'am.
they have not.
Ma'am, your slides are not running
My
on
slides.
the screen.
My slides are not running. No.
No, ma'am. It's on fifth slide only.
Which was?
That was the COVID, the second wave, and after that, our COVID. It's only fifth slide, ma'am. Slides are not running.
Oh, I'm so sorry. Just a second, please. Let me call my technical support, huh?
Now it's on sixth. Yes, ma'am. Now it is on fifth and sixth. Now it is.
Is it moving now?
Yes, ma'am. It's running now. It's moving now.
I'm so sorry. Do I need to go back?
Ma'am, can you please put it on slideshow mode? Then you just need to click and it will move.
Okay. Now, is it moving now?
Now you are on 10th slide, ma'am. Timeline isolation.
Okay. So, is it moving now?
Ma'am, it is stable on 10th slide now. Are you moving?
I am moving, but the slides are not moving on the screen. That's
Ma'am, I think there's a technical glitch. You just do one thing. You just click on the slide which you want to discuss by clicking over the side panel. Anji, that's it.
So I will not put it on slideshow then. Is it okay?
Yes, ma'am. Just click on the slide which you want to discuss, and then it is visible to all of us.
Okay. So do I need to go back quickly? A quick recap? Is it required?
Yes, ma'am. Just
quick recap.
Okay, so just a quick recap of what we heard. We talked about the rise in the second wave was because of the mutant virus and our COVID inappropriate behavior. Then I discussed that even though the outbreak seemed to be decreasing, we still need to be mindful of this COVID, and we need to ensure that we follow our COVID appropriate behavior, get ourselves vaccinated, and in case we do turn out to be positive, we need to stay calm and monitor very closely. Remember that 20% of the patients would require hospitalization. 80% can very safely be managed at home. And looking at the disease course, we've already discussed that it progresses from mild to severe. And in the mildest of the forms, the symptoms are, as we just discussed, dry cough, fever, fatigue, headache, and once it takes a turn for the worse, and it would be evident in the form of a breathlessness, increase in cough, fever not settling down, or falling, oxygen saturation levels. For home care piece, remember that isolation is very, very critical, and we have to take care of both the patients and the caregiver here. Timelines with respect to isolation, as I just mentioned, 14 days is what you need to remember. And in case if you're a high risk contact, then 10 days is what you should be isolating yourself. Get tested, and either at the end of 10 days or whenever you develop symptoms during that duration. Now, remember one thing: if a patient is, a patient of transplant or oncology, and they go on to develop COVID, in that cases, the isolation period may be extended from 21 to 28 days. And also, if a patient has been hospitalized, very sick, very critical, in those cases also, the isolation period may be extended from 21 to 28 days. And why it is? Because such patients are not able to clear the virus from their bodies, and they keep on excreting it, live viruses, for a longer duration than an immunocompetent host like you and me can. So just be mindful of these few durations, although your doctors in charge will always be telling you, these kind of guidelines to follow should the need arise. Now for home isolation, am I good, ma'am, with the slides?
Yes, ma'am.
Yes, ma'am.
All right, all right. So the prerequisites for home isolation is that, very importantly, you need to have a dedicated, separate, well-ventilated room, and having a washroom attached to it. That means a patient needs to be given a single room along with the washroom, and which should not be shared by other members around. And in fact, it will be very interesting to note that many years ago, a similar outbreak from a cousin of corona happened in the eastern countries of the world, the Hong Kong and China, what we call is now known as the SARS. And in that outbreak, what they detected was that route of transmission was through the washrooms. Why? Because it was a multi-storied building, and there was a patient who was on a lower floor, and the patients above that floor also got infected. And what they kind of tracked it back to was these washrooms ducts and the the kind of ventilation channels which were available to for the virus to transmit. So it gets aerosolized, and in washrooms, because of the turning of the cisterns and all, so there is a potential for the virus to get airborne and get transmitted. So therefore, the need for a separate washroom is there. As I said, we need a caregiver, and even if a caregiver is not present, but if you are relatively mild symptoms healthy, you can also take care of yourself, but you should have a good supporting network around you to take care of your needs. And also, only asymptomatic and mild infection needs to be isolated at home. If you have certain comorbidities like uncontrolled diabetes, like your transplant, or you're immunosuppressed for any other reason, or if you're very elderly, it's always a good practice to have a hospital-based care, because you never know how the disease is going to behave in these age groups of people. Having said that, once you have these things in place, remember that the principles of home isolation hinges around three aspects: self-isolation, self-monitoring, and surface cleaning. And why I'm saying self-monitoring? Because you would be required to monitor yourself while you are under isolation. So a lot of things have to be done by the patient themselves. Unlike other diseases where there are a lot of people to fuss around you, here it's you have to be very atmanirbhar and just take care of yourself all the time. So the important part is you stay confined to your room for a period of 14 days. Now, that's not easy, but yes, that needs to be done. As far as the room requirement is concerned, you avoid shared spaces in your home. Very often we hear that, patient has been isolated, but for his meals, he's coming to the dining hall, or he's watching TV with the other members. That is not to be done. Single room isolation means single room. And of course, if the room is well ventilated, it's a very good idea. You can open the windows, providing they're opening into the outdoors and not into somebody else's room. So that is about the facility. Regarding general hygiene, you need to maintain your personal and environmental hygiene. Have a bath every day, keep your surroundings clean, and if you can, you must wash your clothes when required. You can dip them in 1% hypochlorite, or you can wash them in detergent and hot water, dry them up. Even the utensils that you're using for your food, just have them cleaned a little bit with detergent before you pass it on to your caregiver. And in case a caregiver is doing all the above tasks, remember to wear a mask and gloves for all activities involving patient care. And if you have a plastic apron, please also wear it. The idea is to protect yourself from any contact with the viruses. And and the viruses would be present in patients, surroundings, its patient's secretions and excretions. Once you have done your activity, the caregiver can remove the PPE and do hand hygiene. And very importantly, regarding behavior, avoid meeting any family members to protect them, right? Do not invite people to your homes, during that period. And you must wear a mask and maintain social distances if you need to interact for any reason, if you need to interact, ensure that you are completely covered up. Both the parties, you and your family members, are wearing masks. Follow cough etiquette. That means, block your coughs, and if you're having cough, it would be a good idea to wear a mask, because it will again contain the secretions and not allow the virus to get deposited everywhere. Frequent hand hygiene is extremely important. One important thing is that COVID positive people can stay together, and for them mask may not be required when they're interacting with either. Very often we get these questions, I'm also positive, my family member is positive, can we stay in the same room? Yes, you can. And sometimes we say the other way around, if the families get affected together, it's sometimes easier, because trust me, managing this isolation and non-isolation is not so easy. It's not so easy, especially if you're living in smaller places and you have confined, smaller houses. Then this isolation is extremely challenging. Now, the things that you need to have, you must have, and if you have not bought it, please do it. Have a thermometer and pulse oximeter available with you. Of late, there has been a shortage of these equipments because they were so easily whisked away from the market as they were available. People actually traveled from other cities to sometimes pick these oximeters when there was a peak happening, especially in Delhi and all. So it'll be a good idea to invest in these two very small medical equipments and keep them handy with you. And you must always have an emergency contact number of a hospital or doctor on your quick dial system. So what you need to do with it, remember that you need to monitor your vitals, like temperature, like pulse and oxygen saturation, at least twice a day when you're in isolation. And we're not saying more than that, but twice a day is good enough, or more if required, and we'll discuss in a while. And how do we do that? Of course, everybody knows how to take the temperature, but for pulse oximeter, remember, I'm sure you would have had exposure to this particular small device. It's like a clip kind of a thing. So you open this clip and you put your finger, as has been shown in this diagram, put your index finger inside this particular clip. There's a small groove where you can place your finger, and press the button on. Do not shake the finger. Keep relaxed and allow the readings to stabilize. As you see on the monitor, what will happen is there will be some smooth wave kind of waves do come up at the bottom of the screen, and the waves will get smoothened out or regular after a while, and that is the time you should take the reading. Very often people make mistake is, they no sooner that they put this device on, they note the readings, and at that particular time the readings have not stabilized and maybe falsely flashing as very less, 89, 85, 86 or something like that. So please learn to use it well, and once the readings have stabilized, take those values and it will show you both your pulse as well as your oxygen saturation. Now, important things for the ladies and the girls here is, do not wear your nail paint because they may obstruct with the correct reading. Now, for pulse oximeter, it's very important to understand that you do a resting value, and then after that, you do a 6-minute walk test, which means that you walk or pace around in your own room for about 6 minutes, and then you take the same reading again. And I'll tell you why. What is the purpose? Many of times, it's been our experience, no matter how much you tell the patient, that they'll just do the resting value and they'll forget to do the 6-minute walk test value. Now, this value is very important because it's a very early marker of any deterioration. The first thing that is going to change is this particular parameter, and it gives us a good information to gives a heads up to act in a very timely fashion. So with these things, what you need to do is you need to monitor your oxygen saturation, your temperature and heart rate. And if you can see at the upper part of the slides, I've written the normal values. The SpO2 in a normal person and a resting could vary from 95 to 100. Obviously, temperature generally remains low grade with COVID, but less than 101. And heart rate is also, will not go generally beyond 100 degrees centigrade. But there are certain warning signs that you need to be aware of. For some reason, if your resting oxygen saturation level falls below 94, or there is a more than 3 levels drop from the resting values. For example, your resting value was 97 and now it becomes 94, right? And it's dropping before 94. So you need to be careful, right? And also one important word of caution is if you are seeing a drop in the value or the absolute values are also less than 95, do it multiple times. Sometimes you cough and all, there could be some variation in the SpO2. So make very sure, do not panic at just one level. Measure it over a period of time. This is just a warning sign. The body is giving you time to react to it. So just don't, pick up the call and straight away reach to the emergency department of a hospital. So just be calm, measure these values over a period of time, discuss with the doctor, and then we need to act upon it. Similarly, if the high-grade fever is not settling down, it's been more than 5 days, and your fever is actually increased, probably it's 101 or more. Again, that's a warning sign, and you need to connect with a doctor. And these are the times when you need to seek medical help urgently. Apart from that, one can also have restlessness, drowsiness, increase in cough, and these are also clubbed under the warning signs. So please, if you're in home isolation, be aware, be mindful of these factors or these signs, but again, stay calm and do not, get panicked if there is any otherwise values coming to it. Now, do you need to get yourself tested at that point of time with respect to blood and radiology or the investigations? A lot has been spoken about CT scan. Should we do it? Should we not do it? CT scans are more, reflective of it sometimes, even if the reports are negative, even if your RT-PCR report is negative, the CT scan, is very, very suggestive. Yes, that's true. But let the doctor decide when you need the radiology. On your own, you really don't need to get yourself tested. If you are RT-PCR positive, if you're fine, if you're mildly asymptomatic or not symptomatic, investigation on day one may not actually be required. But you need to be careful. Blood workup is done around day 5 or 7 to pick up mild cases going into moderate, right? So there are certain blood markers which we use, like CRP and interleukin. These are the markers that we need to use to see the progression of the disease, and if they're jumping to high levels, again, that's a warning sign which we need to act upon. Similarly, CT scan, it can be done for, if you have a post-work saturation, in case the labs are getting deranged, or in case there's an increase in cough, because a CT scan also gives us an important information. Now, remember, if you're symptomatic, right, if you're having typical symptoms as we just discussed, but your RT-PCR is negative, many times your doctors would actually advise your CT scan, because as I said, RT-PCR is sensitive in only about 70% of the cases. 30% cases can actually be missed. So blood and radiology are definitely very important tools for us to make the assessment of the disease status and also to check for the prognosis of the disease. Now, a lot was said about the oxygen therapy also. Who needs to go on oxygen therapy? Now, we advocate that usually the oxygen therapy should only be administered in a hospital settings, and that too when the saturation is less than 94, right? Home oxygen therapy was only advocated under these dire situations, as we saw in these last 2 months when the hospital beds were completely inundated and we didn't have their easy availability. But that too, if you're doing that, it has to be under supervision. So please remember, oxygen therapy is only for hospital setting wherever it's possible. Having said that, apart from these normal monitoring and the warning signs, what you need to do is you need to take good care of yourself. You need to take your medicines and foods appropriately. Fever has to be managed with simple fever-reducing medicines like paracetamol or Dolo. We recommend a lot of vitamin supplements like vitamin C, vitamin D, zinc that needs to be taken. Gargles for sore throat. If you have a runny nose and cough, steam inhalation is very, very good. And any of the medicines that you're taking by a doctor, that you're already taking, you must continue taking it. And it's extremely advisable to have medical consult at this point of time. Even if you're under home care, these most of the hospitals are offering the services of teleconsult. Even the standalone doctors' clinics are reaching out to people, organizing these telephonic consultations. And you must always take account of that, because no two people behave the same fashion, and it would be very good to have a medical advice handy, even though it's a very simple one. And if you're diabetic, again, I want to emphasize that please ensure good sugar control, monitor it more frequently. If you're not doing it earlier, please do it now, because diabetes is an absolutely dangerous thing to have, in the sense that it can compound not only COVID but many other complications associated with it. So please take care of your medicines on time. Your food, please take light and easily digestible food. Now, what happens is many patients, they lose this sense of taste and smell. So food doesn't taste nice at all. Sometimes you feel as if you're eating sawdust, and therefore and loss of appetite is also there. So you may easily skip having meals, but don't do that. May not eat very fatty meals and all, but simple, light, and easily digestible foods you must have. And very, very important to have plenty of fluids in any form, right? Soup or juices or shakes or simple water. But yes, alcohol is not advocated. So restrain and refrain from alcohol, and take care of your timings of food and medicine. What happens also is that many patients go on to develop cough in this, and the cough could also both be dry cough and productive cough, which can be very, very incapacitating for our patients. So again, the trick remains that keep yourself hydrated, lots of fluids, warm fluids, soups, broths, etc. Steam inhalation is good for both dry cough and productive cough. The only difference is that for productive cough, you need to do a lot of chest physiotherapy, right? You kind of pummel your chest so that you can bring out the phlegm, and when you're disposing the sputum, remember it's laden with those little bugs. So please be very careful to decontaminate it first. Add some hypochlorite to your sputum mug, or wherever you're spitting it out like a sink and all, also clean it thereafter. So these are certain hygiene measures that you need to be watchful of. You have to do it, you can't ignore it, as for yourself and for the others also in the house. Apart from that, it's very, very important to maintain a daily routine. It's very easy to, forget everything, since don't have to go out anywhere, you don't have to do anything. So people just tend to get lazy, and they kind of their routine goes for a complete toss. But it would be a good idea to maintain a daily routine, not only for your physical being, but also for your mental health. Keep active to the level your body allows, which could be easy pacing, walking within the room. If you have some outdoors available to you, you can do that. And outdoors, I mean just outside your room, not meeting any other people. I'm not saying you please go to a park and all, only in the confines of your house. Sometimes the facility could be available. For example, you have a room with a terrace or something, so you can do the easy walking, stretching. The bottom line is keep active, right? Alongside, you can also do some breathing exercises, which are very good for your lung, but don't push yourself. This is a state, a catabolic state. Your body, the virus has really kind of, it runs down the body. So do not overstress yourself. You don't have to prove to yourself that you can still do what you were able to do earlier. So just easy breezy, and yes, get plenty of sleep, catch on to all your Netflix and everything that you wanted to kind of watch all those times but never had the time. But easier said than done. We all know that isolation, we are all very social beings. We like to be in touch with people, and this pandemic has already reduced our social interactions. And with isolation, we are completely, cut off from everybody else, and that can add to the stress. And for that, my first request is, please do not watch too much of news and social media posts on COVID. There's so much of negative media which is available, and it's I think it's their business strategy, because the negative news catches more eyeballs, and therefore you will hear so much of sad stories, so much less is spoken about the good stories which are happening, isn't it? So therefore, refrain yourself from watching too much of news on COVID. Very important to stay connected with family and friends. You have your smartphones, so very important, to stay in touch. Talk about your feelings in case you're feeling low, you're feeling anxious. It's always good to kind of connect. If you have a hobby, you can pursue that, develop, inculcate, you have all the time in the world. Focus on whatever gives you some pleasure and enjoyment, and take one day at a time, and be grateful for the day that went by well. Very important, do not think ahead, do not plan ahead. Just, be thankful that, my yesterday was fine, I'm good, doing good today, and tomorrow will also be a better day. So these are the ways and mechanisms by which you can deal with your isolation stress. Every person has their own mechanism to deal with it, but just, be with it, and believe in it that majority of the patients will do just fine, and they will not need anything else beyond a little, these kind of managements that we have just discussed. For the caregivers, again, if you're taking care of a patient, for example, as a small child or elderly relative who cannot watch out for themselves, then very important that you take care of yourself. You do not want to catch the virus while you are taking care of your family member. So the important thing for all of us to remember is keep your hands clean and away from face, because you do most of your activities with hands, and the virus enters through the portal of your nose and mouth and eyes and so on and so forth. So you need need to make sure that whenever your hands, are going to touch your face, they're absolutely clean. So you can use either soap and water, or you can use those hand gels like I carry this hand gel always with me. So you also do that. Have these available in your home nicely at all these strategic locations. Mask is one very important tool which has really helped many people during this pandemic. So please wear them. Either it can be an N95 mask. Now, N95 mask may not be very easy to wear, and at least as healthcare workers, that's what we wear in the hospitals. But at home setting, if it's not very comfortable for you to wear, you can also use a double mask. That means you wear one surgical mask inside, and on top of that, you can wear a cloth mask. Now, wearing two cloth masks is not advised. It's simply one surgical and one cloth mask, and they have a good filtering efficacy. Ensure that the mask is well worn. Clean your homes frequently, like high-touch surfaces, whatever surfaces you're frequently touching, like your doorknobs, door handles, or any other things that is coming in contact with either the patient or your own hands. You need to keep them clean frequently. Laundry of your positive patient, if you have to do it. One important thing is that allow the clothes to remain dipped in 1% hypochlorite for about 20 to 30 minutes, and thereafter you can wash it with hot detergent into hot water, and they are safe to use. Same with the utensils. If you're using the dishes, you kind of can simply clean them with hot water and detergent if they're good to reuse. Virus is quite delicate in that sense that it gets taken care of by these detergent and easy disinfectants which are available in the market. Avoid direct contact with patients' body secretions, and remember, whenever you're doing any of these activities like cleaning, laundry, dishes, taking care of the patient, always wear gloves and mask, and a plastic apron also, in front of which can protect your front of the body. So these are some of the aspects that you need to be mindful of. Maintain as much distance for as much time as possible from the patient. 6 feet is what we talk of. Change mask. Now, when you change mask, your surgical mask, when it gets soiled, or maybe after 6 to 8 hours, your cloth mask you can simply wash and reuse later on. It's a good idea to press it, because that heat will also take care of the virus. And as long as possible, do not go inside the sick patient's room to clean it till the isolation is completed. Only go if it's absolutely imperative, and then taking all these precautions. And the agents that you can use for cleaning and disinfection is your hypochlorite, your bleach, or quaternary ammonium compounds, which are available in the market very easily. Just a word about mask etiquette, because the way people wear masks is completely mind-boggling. So sometimes people will wear it below the nose, below the chin, on the head, right, carrying it on the elbow. They will frequently touch or adjust it from the front of the mask. Now, these are all very dangerous practices, and it's no good. If you're going to wear a mask, it's as well as not wearing it at all. So please remember this. Look at this pictograph which is being flashed on your screen. All these are wrong techniques, and next time you go out, see how many people are actually wearing masks like that. And that is where the entire problem lies, that we don't understand why it's important to wear the mask. So these are the correct techniques. Buy a mask which is a little broad, which can cover your nose as well as chin, because many times what I have seen is that people wear masks, but the moment they start to talk, the mask kind of slips down from their nose and just hanging just around the chin or around the mouth area. So invest in a good mask and wear it well. In the second diagram, you've seen this gentleman wearing a double mask. It's a very good practice, has been advocated by CDC now, that the surgical mask is inside and cloth mask is outside. Remember that. Surgical mask is very good. It's got a triple layered mask. It's got a little filter inside it. And when you add a cloth mask onto it, the protection level really increases. So it would be a good idea to practice this double mask. I know it's not easy, but friends, nothing is easy with this pandemic, and we all have to learn to adopt these safer practices for our safety and for the safety of our loved ones. There's another kind of mask which is available in the market, which you would have seen. It's a mask with a little valve on the side. Now, this is a pollution control mask. please do not use this mask, because it does nothing for the protection of the people around you, right? Because through this filter, the unfiltered air completely comes out, and the virus gush you'll be throwing out virus gush in case you are positive. So remember not to use this mask for COVID. And also do not touch the front of the mask, because it's the most contaminated area. Always remove by holding it from the strings on the side. These masks, they are contaminated, therefore they need to be disposed of in a particular manner. The surgical mask can be soaked in hypochlorite for about 30 minutes before disposing it off as a COVID waste, while cloth mask can simply wash with detergent and hot water. Remember to practice hand hygiene always, and hand hygiene can be done either with soap and water or with this alcohol hand gels also, right? And remember that when you're washing hands, please Google it, what are the technique for doing hand hygiene. You should do it in a manner that every aspect of your hand is covered, be it your fingertips, be it your interdigital spaces, be it your knuckles, be it your thumb, back of the hand, right? So this is the correct technique for doing hand hygiene. We do a lot of training for our staff on these correct techniques. You also need to learn. So simply just go to the Google website and type techniques for doing hand hygiene, and beautiful videos will come your way. So please learn it. Very simple, no-brainer activity, but very, very important to ensure safety of yourself. So this is pretty much what you do when you're in the isolation. You take care of yourself, you stay strong, take care of physical well-being, monitor yourself, be aware of the warning signs, and raise alarm and alert whenever you feel that something is not going right. So now good news, 14 days are over. So your isolation is over. Now what do I need to do? Right? So 14 days are completed, you're good to go. So recovery after COVID, in many of the patients, it would be absolutely uneventful. You'll be just fine and you can carry on with your normal activities. Most of the patients would recover within 3 weeks' time. But very often we have seen that even the healthiest of adults, they do complain of tiredness and fatigue for a few more days, for a few more weeks after the isolation is over. Some of them can have a persisting cough, which can be very, very irritating. A lot of people have come back to us with the complaints of backache. Now, all these is happening because your muscles are weakened. And why they're weakened? One, because of the infection per se, the virus causing problems. The second is inactivity during these 14 days. You would be surprised how muscles lose their memory once they're not used. So therefore, there has to have a plan for you to get back onto this road to recovery. And important thing for you to remember is that, oh yes, you're amongst those 80% of good fortunate people who have done well. So continue with the good habits that you adopted while you were in isolation, which means continue with the good nutritious foods, a healthy diet which has about 5 colors in your meal, 5 different kind of food substances that you take, the fruits, the vegetables, the pulses, cereals, dairy, everything. Include all these things in your daily meals. Again, keep yourself hydrated, avoid alcohol and smoking for some time at least till you're absolutely fine. So this is important. Fatigue management, pace yourself, plan your work and rest schedule. You don't have to rush everything. Organizations have been very, very kind to people during this outbreak. They have given time off to their people. They have understood the need to give that kind of space. So take frequent breaks if required. Start with light exercises to begin with, as much as your body allows. That's the golden rule to follow. Your body will tell you that it's enough. I will not go beyond that. So do that physical activity, whatever light activities that you enjoy, small good walks, small weights, stretching, etc. And also this says that memory exercises are very, very important, because sometimes it does have some effect on our neurological symptoms also. So do some simple memory exercises like a Sudoku or a word jumble, whatever you enjoy. It will push your brain also into coming back into full activity again. The bottom line is, don't push yourself hard. You've just been through a disease process, that to COVID-19, and therefore you can give yourself that much time to heal in your own time frame. One thing you can incorporate in your daily activity as you go forward is a breathing exercise. We have a lot of literature going on this, that it helps to to kind of strengthen your lung capacity. So you can do pranayam, very good for your lungs, different kind of activities which are available. Again, all sorts of details, information would be available on the net, but do practice it. And for some people, we also advocate, these kind of tools like, blow your balloon, or there's some instrument called as spirometry where there are 3 balls and you are required to blow these balls to a certain height. So all these things indirectly, what they're doing is they are helping your lungs to expand and to regain its lost strength. And you'll be surprised that even many of us healthy adults also don't use our lungs appropriately. We are the lungs are very underutilized because we are not doing these kind of exercises for our lungs. So please do that, and within no time, you will bounce back to your normal life as it was before COVID. Uh, so 4 weeks is what it's going to take at the most. But in very small percentage of patients, we have also seen now complications coming up, which is known as the post-COVID complications. And the buzzword here, and everybody, which is scaring the hell out of everybody, is mucormycosis, right? I'm sure you would have read about it in the papers and all. This is something which is really troubling us, and it's a fact. We're seeing a lot of cases of mucormycosis in our hospitals now, and which are coming back to us. Now, what is mucormycosis? We'll just see in the next slide. And the next part is, of course, the long COVID or long haul COVID, which I have talked about in my earlier slide, which happens once you've recovered from COVID, but some of the symptoms keep on persisting for a prolonged duration of time, to up to as long as 6 months. So what is this mucormycosis? Popularly called as black fungus in the media, but it's not the black fungus. It's a misnomer, and the fungus is not black in nature at all. Now, this mucormycosis is caused by a group of fungus called mucor, and which is also very popularly known as the bread mold. Like if you leave your bread outside, after a few days, you'll start seeing some little cotton woolly kind of a growth on top of it. That is what mucor is all about. And in pre-COVID times, it would only affect people with certain underlying risk factors like uncontrolled diabetes, or patients who were on steroids, or patients who were immunosuppressed, like transplant patients who have had a transplantation and who are very weak, whose immune system is very weak. A healthy host like you and me was not really getting affected by this mucormycosis. But what has happened with COVID is that COVID per se is a risk factor, but the management of COVID majorly, especially for the patients who get hospitalized and all, or who go on to develop a moderate disease, is steroids. And these steroids further reduces your immune system. And not only that, steroids also cause a jump in your blood sugar level. So you have all these factors working together to make you vulnerable to this particular fungus. So remember, people who have had moderate disease, and sometimes even normal people who've had this COVID, right? And especially if they have been diabetic in the past, they may go on to develop this mucor also, right? So remember, what are the symptoms? The major symptoms are a nasal stuffiness and discharge. Now, this fungus also enters, just like COVID, it also enters through your nasal cavity or the oral cavity majorly, or if there's small cuts in your skin, so some of the spores can get deposited there. Spores of the fungus. So what's going to happen is the most common presentation is a nasal stuffiness and discharge. So people will complain that something comes like a muck or a blackish thing comes out from my nose. It's also foul smelling, right? Sometimes people complain of foul smell. There could be prolonged cough, and mind you, this all once you've been diagnosed with COVID, and facial pain is very, very typical. One half of the facial pain people complain of. There could be headache. Some people only have a double vision, right? And some people have this blister inside their mouth, or at times in severe cases there could be a blackening of the face also, as you probably are going to see in this particular middle picture out here. So be very mindful of these symptoms, right? And be aware of it. If such a case happened, this is a medical emergency, and you definitely need to seek medical help without delay. Don't wait for even one day. If you have these symptoms, please reach out to the doctor, your internal medicine doctor, and the best doctor to go to is your ENT specialist. And because this fungus, if it's not managed well in time, it has a propensity to really spread very fast through your blood vessels. It's a very destructive fungus. What happens is it goes inside your nose, it causes problem there. Then from nose, it will travel into your paranasal sinuses here. If not checked, it will go into your eye. If not checked, it will go into your brain, and it can disseminate into the rest of the organs also. So therefore, this is a very angio-invasive, what we call as a fungus, and the key to managing it well is early management, which will reduces morbidity and mortality. And before, and how do you make sure that you do not reach the state, is just keep your diabetes under control, and please do not over medicate yourself or self medicate yourself with steroids. Now this is what we are seeing out in the periphery. A lot of people, steroids are available on off the counter. If I took steroids, somebody else will also say, yeah, my family member took it, you can also take it. So this is a tendency that we do it. If one person has taken it, the entire family will also follow, thinking that if it's worked for that person, it's good for me as well. But remember, as I said, every person is different, every person is going to react differently. So do not over medicate or do not use these medicines without any medical prescription, because they have their own side effects, and these side effects can actually be more catastrophic than the COVID disease per se, right? So don't mean to scare you, but yes, as educated individuals, you need to be aware of it. You have families around you, you can probably talk about these things to them as well, and make sure that they stay well and they report when required. So this is about one of the complications that we are seeing, and in fact there seems to be an outbreak of this particular fungus that is being reported from every hospital in the country. Apart from that, there's something called as long COVID. This will happen once the acute stage is over. And COVID, the SARS-CoV-2 or the virus causing COVID-19 seems to affect many organs in the body in some individuals, right? It can affect your heart, your lungs, your brain, your kidneys, your gastrointestinal tract, your skin, and therefore you can have manifestation of any of these organ system. For example, you can have, cough or breathlessness and persistent oxygen requirement if your lungs have been impacted. If your brain was impacted, you could have some sleep disturbances, you can have headaches, you can have anxiety, depression, you can have chest pain if your heart is involved, right? Also, it can increase the clotting mechanisms in your body, right? So wherever you have any of these symptoms, vague symptoms, or specific symptoms which are persisting even after you've recovered from COVID, it's a good time to again approach your doctor. And for us also, what we need to offer you is a multidisciplinary approach. And for this, many hospitals are now establishing a post-COVID clinic also. And the need of the hour for such patients is coordinate, communicate, and collaborate to ensure effective and continuous care. Because many people may need to get involved in the care. It could be a psychologist, psychiatrist, a dietitian, a pulmonologist. So depending upon what presentations these patients may have, you're still learning about these things, and I'm sure as things progress, we'll have some definitive management protocols also. But as of now, long COVID is managed as per the symptoms that they are presented with, right? So having said that, regarding the management of COVID, but remember there are certain collateral damage also due to COVID which has happened, right? People may have lost their jobs, their career may be at stake. The students, the exams are not happening, so there's anxiety all around. Sadly, a lot of people have also lost their lives, and this time the COVID was so close to home, and many of our families we have seen. Member here and there losing their lives to COVID. So there have been bereavements in family, and the social isolation that we all had to undergo for the last 1.5 years has really taken a toll on all our collective psyche. So these are the collateral damage due to COVID, and for that we really need to stay connected, family and friends. We need to have a good support system. We need to be reaching out to each other and manage things accordingly, right? Just to summarize, therefore, whatever we have discussed, remember some things that we must always keep in mind, that COVID is still around. So therefore, we need to follow the COVID appropriate behavior. Don't just throw caution to the wind. Still continue with all these precautions for times to come. Third wave is also going to come. There will be a fourth wave, fifth wave. The intensity may decrease, hopefully. And we also hope that the virus doesn't change its character too much to become more virulent, right? So we still don't know so much what's going to happen. Time is only going to tell us, but be careful, right? Don't ignore the symptoms. Very often we have seen that people just don't get themselves tested. Get tested, because your management starts according to that particular test also. So test, trace, treat, and test, trace, and treat is what we follow to check the viral spread. So be a responsible individual. It's not just about you, it's about others also. Okay, so because you don't want others to get infected. Not getting tested simply delays the management. Very often patients present to us, they may have had exposure 5 days back, 6 days back, but seventh day when they are coming to us with symptoms, we start our management protocol taking the day 7 as day 1. And we all know that the virus intensity increases during the second week, right? So therefore, there's a miscalculation also happening on our part, and we may not be able to offer you the right treatment protocol as per the time duration. So remember, it's important, right? And isolation is not symptoms, not just test. I start showing my symptoms today, I test myself 4 days later, so my isolation should start from day 1, because again, the whole idea is to contain the transmission of the virus. So remember, isolation is on symptoms and not just the test. Seek medical advice, very important. No two patients behave the same. So good idea to have these teleconsult services available from your doctors around, reach out to them. And last but not the least, now that the vaccines are available, take them. They are efficacious. They have shown to reduce the intensity of the disease. Finally, a few frequently asked questions, right? I'm answering them upfront. If you have any of them, if you wanted to post them in the chat box later. But, some of these, I'm just addressing it now. What do I do if my symptoms persist, right? Even after COVID, as I said, seek a doctor, reach out to them. When do I end my isolation period? 14 days with no symptoms for last 3 days. Now, do I need a negative test to end isolation? Certainly not. The recent ICMR guidelines have done away with this requirement. Gone are the days when patients apply, poster would be put outside the house and you'll be tested again and again till you turn negative. No, it has been nicely demonstrated that after about 7 or 10 days of infection, the virus is not infective anymore, and therefore after 14 days, we are not needing any negative test per se. Now, there would be certain other requirements. For example, some organization needs it for joining, you need it to appear for exams. That is a secondary, another thing. Now, can I get reinfected with COVID? I've had COVID. Can I get reinfected again? Well, theoretically, the possibility is there. It will depend upon the evolution of mutants and the vaccination history taken. Some reinfections have been reported, even in our country, but it remains rare. It's believed that once you've had COVID, your immune system would be geared up to address the challenge of another infection and will be adequately able to address that. So do I take vaccine? I have had COVID. Why do you need to take the vaccine? Should I do that? Yes, of course, you must, because we still don't know how good this natural immunity is. And vaccines, when you take after COVID, they actually augment your immune system and they actually make it more effective. So the literature available as of now does advocate taking COVID vaccine after the disease also. And how much should I wait after COVID for vaccination? Wait after. So generally, it is said that 3 months. I mean, just don't. This 84 days and 4 weeks. I've mentioned this date as the interval between 2 COVID vaccines. But I'm sorry, it should have read after. You must wait at least 3 months. That's what the government recommendation is now. That for vaccine, if you've had COVID, wait for 3 months before you take vaccine. And once you've taken vaccine, the first dose, Covishield, the interval to the next dose is 84 days, and for Covaxin, it's 4 weeks. Now, will vaccine prevent reinfection in future? Well, it will definitely prevent severe disease. It does prevent reinfection for many of the patients, but it definitely prevents the severe disease in a patient if it happens. And while you do all those things, remember to follow the COVID appropriate behavior, which means masking, social distancing, and frequent hand hygiene. Lastly, what are the lessons that we can learn from this pandemic? Let's be kind to each other in nature. Let's be grateful for our blessings that we are good, we have dealt it well, we are negative, our friends and families are fine. Thank all those who supported us in these very tough times. Don't lower your guard. And from students, we definitely expect them to be the change agent for the social engineering which is required for this pandemic, right? So please influence people, to follow this correct behavior. With this, I end my presentation. Thank you very much, and my sincere apologies for the technological blip earlier on in the presentation. I hope I have been able to address some of the queries, but if you have these questions, I'll be more than happy to address them in the chat box or whichever way you feel is comfortable for you. So thank you once again, and thank you, Team MCM, for this opportunity. It's indeed a very, very burning topic, and I appreciate you, and I thank you for taking it on with your students.
Thank you, ma'am. Thanks a lot. Ma'am, we have some queries in chat box.
Yes, please.
Pallavi ma'am, just a second. Ma'am, could you stop presenting your PPT? We would like to present our
Yes,
banner.
yes,
Thank you,
please.
ma'am. Thank you. Yes, Pallavi ma'am, you carry on with the question answer session.
Yes. Ma'am, there is some queries
Yes.
like symptoms for COVID. Is weak eyesight a symptom for COVID? One of the queries, ma'am.
Well, weak eyesight, not specifically, but it can be part of a general weakness, right? But not particularly that you stop seeing or something like that. It's not a defining or presenting feature of COVID. There are more other defining symptoms which have been reported.
Okay, ma'am. There are some other queries also that please help by highlighting the preventing measures we need to follow at home to avoid the spread of this black fungus.
Mm-hmm. So I'm sorry. Can you please help by highlighting the preventive at home to avoid this? So for mucormycosis, now where does this fungus appear? Where do you find this fungus? This fungus is generally present in environment, right? In soil, in things like dirty surroundings, etc., etc. So keep your surroundings clean, right? And if you're immunosuppressed, don't go into the areas wearing open kind of clothes, wear covered clothes so that your skin doesn't come in contact if you have a breach in skin. Avoid going to construction sites because there's again a lot of spore burden is there. And in the home, simple measures of keeping your house clean and not having dust around it, not having your stale things like a bread which is getting stale, or you have those moisture in your rooms, etc. Keep your house well ventilated, well aired, and these are the precautions that's good enough.
Thank
And
you,
mucor,
ma'am.
one thing I would like to highlight is mucor doesn't spread from one person to another like COVID. It's not that I have got mucor, it will spread to my family also. It doesn't spread like that. And for healthy adults to get mucormycosis is extremely rare. It's not that if I'm fine, I don't have any diabetes, I don't have any predisposing factors. It's very rare that I'll get mucormycosis there. But yes, if you have family members who have uncontrolled diabetes, and especially if you've had COVID or they were given steroids, then the risk factors increase. And this fungus is present everywhere, right? So therefore, make sure that your house is clean. You're not doing this gardening and things like that. Avoid doing those kind of things with hands, and keep your body surfaces covered so that even if you have some minor cuts, the spores do not get deposited there.
Thank you, ma'am. Ma'am, there is another query that is the girl on her periods can get vaccinated during
Yes,
that
yes,
time?
yes. There's no such contraindication that you cannot get vaccinated. There are only few situations where you would not like to give your COVID vaccination. For example, you are having symptoms of COVID-like symptoms, cough, fever. We wouldn't want to give you vaccine at that point. Or you're still in the recovery period from COVID, right? Or somebody in your family is got a COVID, right? So the chances are that you may also have gotten the virus from that. So these are the conditions, and some absolute conditions like some you have got some bleeding disorder like hemophilia and all, because in that cases when you give an injection it may not stop bleeding at all. But otherwise most of the contraindications that were earlier there, they have been removed and you can very easily take vaccines. Yes, history of allergy, if you have severe allergy to any other vaccine in the past, you must always give it to your caregiver so that they can take an informed decision.
Okay, ma'am. Okay, ma'am. If someone is suffering from low BP or high fever, weakness after vaccination, is it normal?
Yeah, so I see in our hospital we're given vaccine to so many people, and we haven't really seen anybody going down with these kind of symptoms, but they happen reported. So fever is the most common manifestation, and most of the people, what happens is fever will resolve within 24 max of 48 hours, right? All you need to do is take paracetamol and dolo, and that will be fine. But we have seen some of the people going on to develop severe anaphylactic reactions, right? But that happens within half an hour of taking vaccine. That will happen within your. That's why after vaccine you're allowed to wait for 14 for half an hour for monitoring purpose wherever the vaccine has been given, and that of course needs a medical treatment. And if you're in a hospital setting, that will be taken care of. They give you some injections and you'll be fine. But in majority of us, we have seen that vaccines have not really caused any problem. Yes, we hear a lot of things about deaths happening after vaccine, and people having these clotting disorders. In some cases, they have been reported. I will not deny that. But if you look at the public health perspective, there are far more benefits in taking the vaccine than not taking it and going on with COVID and having so many other complications. So it's always a risk versus benefit analysis, and in that, vaccine definitely comes the tops up.
Okay, thank you, ma'am. There is another query that if someone is suffering from viral from last 15 days or 18 days, so should she take vaccination or not?
No, no, no. You have to wait till you recover. And if you're having a viral, first thing is to get yourself tested for COVID. It's very important that we need to rule that out. And as I said, if you are having any acute illness, right, or if you have taken any other vaccine in the last 15 days, we would not like to give you vaccine. Because see, what happens is if there is any complication due to vaccine, we'll not be able to monitor whether it's because of previous disease or because if it's because of the vaccine. And if you're already having COVID and if you give vaccine at that point of time, it doesn't help. It doesn't help at all. So therefore, you need to recover well from your infections before we can offer you vaccine. And if you have taken any other vaccine for hepatitis or any other vaccine, we want you to wait for another 2 weeks before you can actually go for it.
Okay, ma'am. There is another query that if we don't get second dose of vaccine at right time due to its unavailability, can it be delayed for?
Yes, yes. So, there's no hard and fast rule that 4 weeks means 4 weeks, 28 days means 28 days. After 28 days, 30 days is also fine, 35 days is also fine. So, what the second dose is actually doing is, the first dose has already primed your immune system. Once you give the first dose, it goes and engages with the immune cells, it activates them. And the second shot, when we give it, it augments it. It kind of increases that response. So second dose is important to make it more robust, but hard and fast that timeline is not there. As you would see with Covishield, we have shifted the goalpost from 4 weeks to 8 weeks to now almost 84 days. So therefore, we would definitely want you to take the second dose and don't delay it for maybe 3 months, 4 months for Covishield and 6 months for for Covaxin and 6 months for Covishield. But roughly around that much time, 1 or 2 weeks is not going to make any difference.
Okay, thank you, ma'am. Ma'am, these are NSS volunteers, so they want to know how to assure people regarding this vaccination.
Yeah,
Because in many areas.
Yeah. So vaccine hesitancy is a very, very important challenge that we are facing, all of us. And what to talk about general population, even our healthcare workers, when we began, there was so much of hesitancy around there because it's a new vaccine. It just came within 1 year of the pandemic. So the trust factor takes time to develop, right? Moreover, many people think that we are young adults, right? Nothing is going to happen. But the second peak changed many of these things for us. We saw in the second peak, many of our youngsters, going on to develop this particular disease. Today only, in fact, I was reading in the newspaper, a young 24 years old teacher, in fact, lost his life to COVID, from Chandigarh. So that was very heartbreaking, that young people also getting impacted by it. So now at least we are seeing there's more acceptance for the vaccine. People are realizing, and it's my personal experience. What we have seen in the hospital is that all those people who are vaccinated, when they got the disease was much milder. It could simply be managed at home. Vis-a-vis those, which were not vaccinated, they required hospitalization and very intensive medical management. So we have to believe in science, right? We have to believe in science with a little leap of faith, because we have to find there are so many naysayers also. There are equally large number of studies which are also available. The things which are adverse events which are being reported. So that does create a scare in our mind. But the whole world is talking about it. Vaccines are important. So all you need to go is talk to people, engage them again and again, understand what their fears are, right? Just don't say that you're stupid, this doesn't happen. You need to understand why they're saying what they're saying. And a peer influence is extremely important. Like even with us, when the vaccine drive started in our hospital, we saw the doctors led from the front. Most of our doctors took the vaccination first, right? And when they did that, it generated confidence amongst our junior categories of staff also, that yes, my senior most doctor has taken the medicine, I'm sure I can also take it, right? So it builds up. You have to just talk about it, you have to give them examples, you have to do the advocacy, you have to share the concerns, address it. There's no one formula for it. You can involve your religious leaders for it. Many people have this huge fan following for the religious leaders. So as NSS volunteers, you can engage with them, try and present evidence, try and discuss with them, try and understand their concerns, and then they can act as a change agent. So again, it's advocacy again and again and again. But as people, we are hesitant. We have seen this phenomena across the world. Vaccine hesitancy is a known thing, and the only thing we can do is talk and talk and talk about it.
Thank you, ma'am. There are many queries, and one query is there that if someone is taking insulin, so should he or she go for this vaccination?
There's absolutely no relation between these two things. Insulin is injection that we need to take for your diabetes, and you must continue with it, because sugar control is extremely important, not only just for COVID, but also for the prevention of its complications like mucormycosis. Under no circumstances should you not take the vaccine because you're taking insulin. Insulin is important, so is your vaccine. Go ahead, it is very safe. There's no relation absolutely between the two of them.
Okay, thank you, ma'am. Ma'am, student wants to know about the measures to improve our immunity.
Well, immunity is a very complex thing, right? But the easiest thing to do is that, have a good nutritious diet. We are in the habit of eating a lot of junk food, right? Takeaways, all these pizzas and burgers, they're very good to eat. They're very exciting to eat, but they're not healthy at all, because they contain lots of fats. They contain lot of these preservatives, which doesn't do anything good for you. So remember to include good amount of fruits and vegetables in your diet, right? Have a good protein source like eggs and these paneer and cereals, and also combine it with some amount of nutrients. And I would say for that, your nuts, your almonds, your walnuts, your things, your masalas that you take, right? Your ginger, garlic, everything, whatever we eat in our Indian traditional meals are extremely good. Our forefathers had great insight into this healthy diet, and they included everything in our diet. So if you look at our Indian diet per se, it's very, very wholesome. It contains everything. So remember that you use that. Good diet. Exercise is very important. Exercise not just builds up your immunity, it also adds strength to you mentally, and it releases a lot of those happy hormones in you, endorphins and enkephalins, and the body has a very intense microsystem inside, and they all engage with each other to ensure that you stay healthy, right? And then follow healthy habits. Hand hygiene is important. Cough etiquette is very important. So these are the ways you build up your immunity. So exercise well, eat well, hydrate yourself well, everything in moderation, right? Stay away from smoking, not good for your lungs at all. Everything is in moderation, right? So these are the things you can adopt. These are called as lifestyle habits, lifestyle changing habits. It's not like one day you do it, and so it has to become a way of life for all of you. So this is where you can definitely improve your immunity.
Okay, ma'am. One more query, that after recovering from COVID, is it necessary to take vaccine?
Yes, I did address it in my presentation also, but after COVID, also as of now, it is recommended that you must take vaccine. Now, why is that? Because we don't know one that how long your natural immunity is going to last, and it's believed that in coronavirus, the natural immunity will wane off after some time. So vaccines are given to augment these particular immune system, and also it is believed that in future the viruses may mutate, and that therefore vaccines will also be need to modify to undertake to take care of all those mutations. So yes, as of now it is recommended that you must take vaccine, although you must wait for 3 months after recovery from COVID before you take the vaccine.
Thank you, ma'am. I think you have solved all the queries of our students. Thank you. Thanks a lot, ma'am.
So pleasure is
So,
mine.
thank you, ma'am. So, at last, a formal vote of thanks for you, ma'am. That on the behalf of Meherchand Mahajan DAV College for Women, Chandigarh, NSS units, and medical committee, I express my heartfelt gratitude to Dr. Anita Sharma. She took time out of her busy schedule to awaken our students. She effectively highlighted various points. She suggested that how one should to focus on physical and mental well-being as well as personal and environmental hygiene. She emphasized that it is important to understand that a caregiver of such patient also needs to take care of themselves by ensuring COVID appropriate behavior of masking, hand hygiene, and distancing. The session was really very enlightening, ma'am. Apart from this, I am thankful to the principal, Dr. Nisha Bhargav, who always remains a source of motivation for all of us. I am thankful to Dr. Sarabjit Kaur and Ms. Meena Bhattar, who helped us in organizing the event. Last but not least, I am thankful to the students who joined this session and showed their keen interest. Thank you, everyone. Now I request you to switch on your cameras to have a group photographs. So please switch on your cameras.
And we get to see all the lovely girls here. I can walk on.
Ma'am, it's done. Thank you.
Thank you, everyone. Thanks a lot.
Thank you, Anita ma'am. Thank you so much, Sarabjit ma'am.
I think ma'am has already left. We can
Yes,
let the
ma'am.
Okay.
students leave the.
Okay. Girls, you can leave now. Ma'am, just a second. Ma'am, just float the attendance from feedback link.
Okay.
So basically, we should thank our students for their cooperation.
Yes, ma'am.
Good NSS team.
मैम हमारे बाकी बच्चे भी थे. Let me stop the recording.